This is Ritika Bose on behalf of Redcliffe Labs, extending a warm and hearty welcome to all of you. Today, in our live session, Dr. Ankur Jain, MBBS, MD, DM, Senior Consultant Gastro, and fine as we wrap the year. Christmas is round the corner, and as well as the New Year. सबके बहुत सारे plans तो होंगे ही. सब कहीं ना कहीं घूमने जाने का प्लान कर रहे होंगे, सब ट्रिप्स की प्लानिंग कर रहे होंगे, वेडिंग्स भी आ रहे हैं और नया साल with the winter season around, there are a lot of plans everyone has, and everyone must be in excited to enjoy this winter season. So Dr. Ankur Jain, he has joined us. Let me introduce him. He's MBBS, MD, Senior Consultant Gastroenterologist. With years of experience and guidance that he has given to his patients, they have helped make a difference in their lives. And today, with his expert tips, we will be making a difference in the lives of our audience and knowing how we can wrap this year up in a healthy manner. Doctor, it's a pleasure to have you in our show.
Hello, everyone. It's a great pleasure to be around and to be able to help you guys enjoy this festive season. So, tell me, how's your
Christmas? The Christmas is round, and I'm sure a lot of people have plans to travel, and then Christmas means cakes, sweets, and the year is going to end. Winter is around the corner, and everybody must be in that year end है, तो बहुत लोग बहुत excited होंगे, बहुत उनकी जो अभी the mode, that happy mode, that mode that they will be in a holiday mode to enjoy life, to wrap up the year. But while they do so, it's very important कि वो अपना ख्याल भी रखें. तो इसीलिए हमने आज ये लाइव सेशन अरेंज किया है ताकि हम उन्हें बता सके, ताकि जब वो एंजॉय कर रहे हो अपनी ये फेस्टिव सीजन, अपना ये क्रिसमस, न्यू ईयर, तो बहुत हेल्दी रह के ये सीजन एंजॉय करें. तो विथ क्रिसमस एंड न्यू ईयर, the year is almost on the verge to end. There are certain measures that we should take. जब हम पार्टी भी कर रहे हो, एंजॉय भी कर रहे हो, हम मेजर्स भी ले ताकि हम थोड़ा सा प्रिकॉशंस लेके अपने आप को हेल्दी रख सके. What are some of these issues that might happen, health concerns that people might face during winter, and how can they prevent those? Doctor, please, if you could share with us.
So mainly in winters, in party season, there are chances of getting infections, especially viral infections, especially typhoid, especially hepatitis, which usually happens because of consumption of infected food or water. Especially when there's a festive season, we tend to eat a lot of food from outside. So just be careful on what you are eating and where is that food coming from. Usually anything which has been cooked, anything which has been prepared after heating on the stove or oven is usually having less chances of infection as compared to food which is uncooked. So I would suggest avoid any kind of uncooked food from outside to prevent the infection from entering your body and spoiling your vacation. Also, adequate hydration is required, especially when you are partying, you are having fun with the friends. Adequately hydrate yourself. Don't forget to take liquids. Don't forget to take electrolytes, and keep on consuming water so that you are never dehydrated and that doesn't trouble you. Yeah.
So डॉक्टर, ऐसा होता है कि बहुत सारे मैंने देखा अपने दोस्तों में, अपने कलीग्स में, कुछ लोग जैसे विंटर्स आ रहे होते हैं या जब वो ट्रैवल करने भी जाते हैं, कुछ लोगों को बहुत ज्यादा ठंड लगता है. दे स्टार्ट शिवरिंग लिटरली, थोड़ा सा भी टेम्परेचर डाउन गया और वो शिवर करने लगते हैं. एंड सम पीपल ऑन द अदर डे, इवन इन विंटर्स, जब टेम्परेचर 9-10 भी होती है या इवन इट्स 15, दे आर लाइक नो, वी वांट द एसी, वी वांट द फैन टू बी ऑन. ऐसा क्यों होता है कि दैट आवर बॉडीज रिएक्ट डिफरेंटली टू द वेदर?
So all of us are different. All of us, although we do have similar organs, the body behaves in a very different way for all of us. There are metabolic reasons. Some people, the body metabolizes the food fast. Some people, the metabolism is slow. So some people, they secrete less heat in the daytime or in the nighttime. Some people, they secrete more heat. So these metabolic causes can be one of the reasons, and then there can be thyroid, which can be one of the reasons, and then there can be a genetic makeup which is different in each and every one of us. So these are the three main things that predicts how the body is going to behave in the winter weather. But keeping that aside, if you are feeling cold, don't be afraid, don't be ashamed. You can switch off the fan, you can switch off the AC, you can wear good winter clothes and protect yourself from the chill weather which is actually present nowadays.
Doctor, there are many people, जैसे winter आता है, they start having like itchiness, dry skin, and some people they have this dandruff also. A lot of people वो summers में तो बहुत healthy रहते हैं, उनके skins या nourishment मिलती रहती है उनको. But जैसे winter आता है, just like this after October, November,
Yeah.
the skin becomes absolutely dry,
Yeah.
and dandruff is a major issue. Why does it happen? Does our gut microbiomes, they impact the way our skin will react to a particular season and affect our body?
So definitely gut microbiome plays a major role in a lot of things, including our skin, including our gut health. So gut microbiome definitely plays an important role, and we should be consuming an adequate amount of gut microbiota like probiotics, like curd or something to maintain the gut healthy. Also, along with that, adequate moisturization of the skin is required, especially in winters in people who are having cracking of the skin. So, gut health and adequate moisturization is the main key to prevent the cracking of the skin, especially in winters.
Doctor, there are many people, especially जब winter आते हैं, we see that कि asthmatic people who have asthma and respiratory issues, it becomes very difficult for them. Now, how does the seasonal change
Yeah.
impact people with asthma, and what are the precautions they should take?
So as we all know, seasonal change in Delhi, in northern India, brings a lot of bad weather, bad wind, bad air, and pollution. And this pollution is one of the major key reasons why people are having breathing difficulties. They are having asthmas, and all this asthma is getting precipitated in this weather. So avoid going out in the bad weather. AQI is 400, which is actually not acceptable range, and it's a very dangerous air that is present outside. Uh, be indoors. Stay away from the sand or dust which is present outside. If possible, use in-room air purifiers so that you can prevent the dust from entering inside. And yeah, so that is one of the major reasons.
Okay. So, doctor, there are during winter, there are people who have severe allergies. What
Yeah.
are some of the allergies that people can be affected with during winters, and how can they prevent it, take precautionary measures against these allergies?
So mainly the allergies that are there in winters can be we can have asthma, which is allergic. We can have dust allergy. We can have pollen allergy, which is there from the cutting of the grains. We can have allergy from the food that is present in the winters. So if there is any known allergen and it is present around you in your diet, in your lifestyle, you have to avoid that and try to keep yourself healthy and away from these allergens so that you can avoid getting the allergic anaphylactic reactions and be safe. Yeah.
Doctor, during especially during this winter season before Christmas, New Year, many patients they tend to go get themselves checked. They must be coming to you कि doctor ये problem हो गया है, वो problem हो गया. Can you share one interesting case that you have encountered recently, and what suggestions did you give to the patient, or how did the patient react when they have any kind of gut issues or health issues? How they react, and how do you counsel and help them out? You just share a story
So
with us.
I'll share one of my patients' story. This child was, I think, 12 years old, and he was fond of having from outside. And there a sudden surge in hepatitis A cases in a particular area near Dwarka in Delhi. And this child loved momos, and he had momos from outside. And then
Oh my God.
after he had this particular infection, and he was having jaundice, but he was not willing to give up on his food habits. And then I had to teach him and educate him that, because of your bad eating habits, because of your infected food only, you got this infection. and it will take around 3 weeks for it to settle down. And this child had vomiting, he had jaundice, and all those bad things that were affecting him. And then gradually he understood the problem, and he promised me that he'll never have food from outside. Yeah.
Doctor, when you have these different patients, like age group, like the children, are they difficult to deal with, or the elders, are they difficult to deal with?
So kids,
You have different types of patients with different age groups coming to you. So which one do you find is most difficult to deal with?
so kids and elderly people, they are almost alike. Even old people are like children, and sometimes they'll not listen to you no matter what. So both these age groups are the age groups which can have problems. And but you, if you talk to them nicely, you tell them what is the concern, both of them will understand.
Nice, nice. So, doctor, when you see an elderly person coming in, and especially with December being a month where people face a lot of constipation issues, gut health issues,
Yeah.
gastritis issues, what kind of suggestion do you give them? That what kind of changes they should make in their lifestyle so that they can, prevent these gut issues and keep themselves hearty and healthy even while they enjoy all the cake and the delicacies of Christmas?
So I usually tell my patients to at least consume 2 fruits a day and a lot of salads and a lot of liquids so that constipation doesn't stop them from having fun in the festive season. Good fiber intake and good liquid intake is the key.
So that's very important.
Yeah.
Okay, so doctor, are there any specific food or nutrients? Because winter is a time when people tend to have viral infection, the immunity goes down, and literally it becomes very difficult. So, is there any specific food that people can have or nutrients that they should consume so that they strengthen their immune system during winters?
Yeah. So I have a lot of we have in winter specifically, we have got a lot of citrus fruits that are available, and these citrus fruits are rich in vitamin C, which actually helps in improving our. Also, along with this, take a lot of probiotics like curd, which increases the gut health and gut immunity. So these are the things which can help us in preventing the infections.
Okay, you said like we should take curd, but there are people, like I have heard my friends say that like curd is not good to be consumed during winter. Is it true that
Yeah.
if we have curd during winter, we'll face we'll
So
maybe get a sore throat and stomach issues?
because curd is usually stored in fridge and people try to consume the curd straight out of the fridge, and this is the time when you get maximum chances of having cold and cough and all. So that is how people feel that the curd cannot be a good thing in winters.
So there is a question our audience has shared. Why does the platelet count decrease during winter, and why do people feel dizzy during winter?
So there is no correlation in between winter and the platelet counts. If your platelet counts are low, definitely get it checked. There may be something else which is going around, and it's not just the winter. And we feel dizzy because we are not able to take adequate liquids in winters. We try to avoid the liquid intake, and that is what is causing the dizziness. And I think that should be avoided.
Uh, now, there are again some people who catch cold easily. बहुत लोग होते हैं जिन्हें viral easily हो जाता है. And there are people की नहीं, वो चाहे जितना भी बाहर सर्दियों में घूम ले, ठंड में घूम ले, बर्फ में खेल ले, ठंडा पानी विंटर में पी ले या फैन के नीचे भी बैठ ले, उन्हें ठंड नहीं लगती है. तो is the like how why is it so कि कुछ लोगों को ठंड बिल्कुल नहीं लगती है and कुछ लोगों को बहुत जल्दी ठंड लग जाती है?
So, some time back, we discussed about the genetic makeup of the people. So, genetic makeup and our body metabolism is the main reason why some people feel cold more as compared to other groups.
Okay. And doctor, there are also people like during this particular season, they are really very okay. We have one more question. I'll take this question up and then maybe I'll go ahead with my question. So, yes, I am 21 years old and I am facing gastritis issues from past 4 years. I used to get the gastritis issue once in a while, but in a severe stage. I took scanning, but nothing was found. I used to get sudden severe pain in the stomach. Why is it so that some people have extreme severe pain suddenly Please, if you
So
could
sudden
help.
severe
uh,
pain can be a sign of gastric infection, and I think this should be checked further beyond an ultrasound. So we can do an endoscopy test, and we can also do some blood tests to identify what is causing your pain. And sudden severe pain needs to be looked into, and I think we should not take it lightly.
Now, during a festive season, people are super excited to plan their holiday, to go on a trip, enjoy. Like this is the year end, they want to wrap it up well. But sometimes while planning a trip, people tend to get anxious and stressed, and especially जब वो trekking वगैरह पे जाते हैं तो बहुत ज़्यादा nervous and anxious हो जाते हैं. So, what are the complications if somebody is planning a travel? What are the health precautions one should take? And if somebody gets stressed on the go on during the travel, how can they calm themselves down, and how can they ensure that they still remain healthy and fit without stressing out or freaking out at the moment?
So yeah, take consuming good food while traveling, adequate liquid intake while traveling, and adequate sleep. Like we when we travel, we try to wake up early in the morning, sleep late in the night, and we usually forget to take rest. So our body requires adequate rest, which is the most important thing. And I think these things should be taken into account.
Doctor, many people, like during winter especially, what happens? They complain of ailments in the heart, their cardiovascular health. They say that we have seen also statistics have shown that heart health gets impacted during winter. So, what are the complications that one, especially the elderlies, might face during winters concerning their heart health?
So, a lot of people, especially the older group, are at high risk of having a heart attack or heart-related emergency, especially in winter time in night when the coronaries or our vessels usually get squeezed. If I tell to make it out more prominent in the local language or in the basic slang, so our vessels are basically not at the diameter or not at the size at which it should be to supply the blood vessel to supply the organs. So this is the time there are high chances of having a cardiac emergency. So avoid going out in winters in very high cold or very low weather, low temperatures to prevent having these kind of emergencies. And also
During
get yourself
yes.
checked. And if you are having some kind of cardiac issue, then probably you should be started on some medication.
Now, doctor, many people, especially the old 60 plus, 50 plus, even we, like people in their 30s, they have the joint pain. They complain of muscle cramps, backaches, and all, especially during winter. Now, why does this cramp increase during winter? What causes our joints to ache, our body to pain so much during winter?
So sometimes our joints are basically like a little machine which is present in between the bones, right? Especially in winters, there is less movement of the joints because we tend to avoid the exercises and we tend to avoid our routine activities, which leads to hardening of the joints. Also in the morning time when the weather is too cold or temperatures are too low, this is the time when our joints start to crackle, and this is the time when we usually have the joint emergencies, like we are having if rheumatoid is there, then that gets aggravated, or if arthritis issues are there, then that gets aggravated and we feel the pain. And when the temperature is cold and we are washing our hands in the cold water, that also leads to reduction in the caliber of the blood vessels in the joints in the hand, and that leads to vascular emergencies of the hand also.
There's one more question I here. Hi, doctor. Just wanted to know how much caffeine, especially during winters, we all depend on caffeine. A cup of
Yeah.
coffee with chai. That's what we wake up to, and that's what we take before
Yeah.
sleeping. So, how much caffeine or chai should we consume daily as winters are here, and does it affect us in any way? Yeah, even I need to know that because I consume a lot of caffeine. My morning starts with coffee and ends probably with coffee.
So there there is no limit set to have caffeine intake. So I think 1 or 2 cup of day of coffee, anything in excess can harm our body, and we should try and avoid excess consumption of caffeine or even all these things to prevent gastritis and GERD, especially the gastric issues which can get aggravated.
When we consume caffeine, how does it impact the gut? Like, what are the complications that can happen? Excessive consumption of caffeine.
So excessive consumption of hot beverages like coffee and caffeine can increase our heart rate. It can cause palpitations, and some people they may have acid reflux and all these kind of disorders which lead to heartburn, and then you can have a bad taste in the mouth, and then some patients they also complains of vomiting along with caffeine intake.
Okay. Too much of so sometimes some people it doesn't suit some people and some people are okay.
Yeah,
Like the coffee lovers.
yeah,
They're okay with too many cups, but people
yeah.
they might react differently.
That's
Right.
because of our genetic makeup again. Some people they are able to have more coffee and tea as compared to other people.
There's one more question. It's around malaria, though. I want to say there are patients that he sees have malaria positive but have no symptoms at all. Why does this happen?
Sorry, I did not get the question.
So the person has put this question that there are people who come out and have been tested positive for malaria, but they showcase no symptom at all. Why is it so that there are no symptoms yet when tested the person is malaria positive or has
So
been detected
there
with
are
malaria?
so many tests which are available these days, and some of these tests are antibody tests, and antibodies are usually present even after the infection passes away. So maybe possible that this in this particular case we might have tested the antibodies, and antibodies are usually also present even when the infection has passed away. So that may be the reason. Yeah.
Yes, coming back to our questions, Doctor, I wanted to know like caffeine intake. Again, you've told like people who have too much of caffeine, it can affect their body, But there are people who are diabetic. How does consuming cake, sweets, and excessive sugar affect people with diabetes?
So yeah, the sugar gets elevated because of consumption of cakes and sweets, and elevated sugars can lead to a lot of emergencies like kidney issues. It can lead to end organ damage like eye damage. So patients who are diabetic, definitely the sugar should be controlled, and these are the people who should avoid taking cake and avoid taking sugars at all times, no matter what.
Doctor, again for women, thyroid and PCOD in women is very, very common. Now, people during Christmas, New Year, they tend to consume liquor, alcohol consumption, your fried food, and your sweets, cakes, especially your Christmas. Christmas is around the corner, so they will consume cakes, especially plum cakes. Now, how does that impact women, especially who have thyroid and PCOD? Their
Uh,
gut, their overall health.
Thyroid and PCOD are basically directly related to our obesity, and consumption of a lot of sugary foods leads to increase in weight, and PCOD can actually worsen because of increased weight, and thyroid diseases can worsen. We may have to go up on the medication for them. So patients who are having PCOD and thyroid issues, they need to check on the calories, they need to check on the sugars, and they need to keep their weight in check.
Doctor, like during winter, what happens? People have come up complaining that their BP shoots up. Now, how does hypertension impact the body of a person?
So now, hypertension is also one of the major reasons for having a neurological emergency like a stroke or
Hmm.
having a kidney issue. So BP shooting up is anyways a bad sign, and we can have a heart attack, we can have a brain attack, and we can have a kidney disease along with elevated blood pressure. And this should not be happening, and we should keep it in check at all points of time. So if you're having hypertension, visit your doctor, start the medication for hypertension so that these emergencies can be prevented.
Now during winter, what happens? We tend to become very lazy. We are people like during winter, हम avoid करते हैं कि बाहर नहीं जाएंगे, ठंड है बाहर. We stop exercising. We stop. In fact, we don't want to leave our cozy blankets. We want to stay clung to our cozy blankets and stay indoors only. That reduces our physical activity. How can we ensure we stay physically fit while we are indoors?
So, continue your indoor activities, continue your indoor exercises, and, just don't keep on consuming the caffeinated beverages, and avoid a lot of consumption of tea and coffee. And I think adequately hydrate yourself and have a lot of fiber, like fruits and salads, so that you don't get a disease while staying indoors also.
Also people who complain that they tend to go into a very sad kind of a mode. This is a season of hibernation, so people tend to go into that sad kind of a mode where they're very gloomy. ऐसा लग रहा है बाहर सब कुछ ग्रे हो रहा है, winter snowfall हो रहा है, तो अंदर ही we tend to start feeling कि no, we're feeling lazy, we feel gloomy and all. So how can people mentally and emotionally strengthen up, can buckle themselves up and can mentally and emotionally stay strong during winter? Especially Christmas is there, the vibe is there, but some people they tend to become like gloomy because of the winters. How
Yeah.
important is
So
it
I
to
think I think
laugh,
talk to your
enjoy?
friends. Talk to your friends. Just don't stay alone at home. Or even if you are alone at home, and you can just make a call, be with your friends, and adequate food intake should definitely be there, and do some regular exercises. It definitely help in the morning. Do some yoga so that you and I think it should be the way.
So yes, dear audience, if you have any questions, we will be ending the session in a while. If there are questions, please put your questions in the chat box, and we'll take up a few questions from there before we end the session. Doctor, so what would you recommend? How can people stay active during winters and ensure overall well-being? What are the 5 tips that you would give to our audience in ensuring their overall well-being and staying active during winter?
I think get in the morning, you have that.
Doctor, your voice is Doctor, your voice is
Can you hear me?
breaking. You're not audible, doctor. Voice.
Now can you hear me?
Yeah, it's better now. Yeah, but your
Yeah.
voice.
So adequate food, getting up early in the morning, going for a regular exercise, adequate food intake, adequate liquid intake, and adequate fiber, and sleeping on time is the key, especially in winters, to prevent uh, getting unwell.
There's one question that's come that we'll be like, this is the last question for the session. We are going to take it. So, any tips for senior citizens to maintain their gut health? Senior citizens and how can they maintain their gut health?
So I think whatever I just told, I think that goes well with the senior citizens also. No additional thing is required for the senior citizens, especially if you are having some kind of cardiac disease or gastric issues. Definitely don't stop taking your medications so that you don't get unwell, and continue your medication, have adequate liquids, and I think that is the way forward.
I think we've had a wonderful session. Many people joined us. They've had so many queries. They put that in the chat box. They've got their answers to it. And I'm sure as they enjoy Christmas and the New Year, they're going to follow these measures and stay active and ensure overall well-being. Thank you so much, Doctor, for
All right,
joining us.
stay healthy. Bye bye.
Take care, dear audience. Bye-bye, and wish you all a Merry Christmas. Enjoy your holidays. Enjoy your winter season. Enjoy the winter vibe, the New Year vibe that's already there in the air, but ensure staying fit and healthy and active during winters. Bye-bye.